COVID affected us in many ways, but specifically as in regards to access to information, it affected us on the side of the patient and also on the side of the staff. When His Excellency the President introduced a total lockdown that in March 2020, most of the patients were getting services at Uganda Cancer Institute, and they were trapped because public transport was cut off. They could not move back to their home areas, and because of this, they needed to be assisted in getting information on the next steps. And as Uganda Cancer Institute, we tried to put some measures in place. We put a task force that really worked very hard to put some measures in place, and these measures were communicated to the patients, to the general public, and to the staff. And among these measures, they included how the patients can access treatment during the lockdown, and we also provided the toll-free line, which toll-free line was disseminated to the public and to the patients so that they kept in close contact with their doctors, with the health workers, so that those who needed the critical attention or emergencies were helped. But those ones also who were in public or in the community, we had to put some arrangements. For example, those who had developed complications and they were in communities, we could write introductory letters which were sent to the local authorities, and the local authorities allowed them to move using the transport system that was allowable at that time. But again, on the issue of the toll-free line, we made sure that this toll-free line, at any point in time, you would talk to your consultant. You could also get information on real time regarding your treatment. But those who were trapped at the institute, we had to take care of them in terms of feeding them, in terms of accommodating them, although the facilities were not sufficient. But we also put up a communication system whereby at any point, every morning and afternoon and evening, a staff would talk to every patient around the campus on the do's and don'ts and all other measures that were introduced by the government and the Ministry of Health, and they were communicated to, and they got information regarding the next steps. And also we had to put up a system. After spending there like 3 weeks, we had to put a system of taking them back because the problem was too big for us to manage them. Since some of them had completed their treatment, some of them had not were not admitted and needed to go back home. We had to arrange with the Ministry of Transport and the National Task Force to put transport for them to take them back. And when we took them back, the buses that took them back home, they came with those ones whose reviews were due. And in that way, we helped the patients to make sure that they don't suffer even if there was this pandemic and the lockdown. But also on the side of the staff, we had on a weekly basis, we had to release information which was put on the notice boards, which was put in the on the website, which was also put on the WhatsApp platform for staff, talking about information on this new disease, how to prevent, how to treat, how to prevent, how to take precautions, how to prevent, and because there was no also public transport, the staff could not move. So whatever information we wanted to pass on to staff would need a channel that can deliver this information timely, because we had to transport all the staff to where they were staying, and these were skeleton staff, not all the staff, because we had to scale down on the number of staff to make sure that we have those ones that were taking care of critical patients. And the lessons that were learned in this is that as Uganda Cancer Institute now, we developed a new modality of communicating, especially in those days before the pandemic. We used to have many regular meetings, physical meetings, but now all those, we have fully adopted the Zoom or the virtual way of meeting, and which in a way has also reduced on the costs of providing refreshments, of so many other things. And also we are now using this electronic platform as a way of communicating to within as staff, and also to the public. And this toll-free, this time around, it became more popular because most of the people needed to get information, and that was one of the ways in which to get information so quickly and so fast. Those were some of the challenges that we can share with you, and our experience together with the lessons learned. Thank you.